Hello and welcome to the Valley. Today I am your host, Janet Michael. It is Community Health Day, sponsored every month by Valley Health. Last month I took a trip over to Winchester Medical Center to have a conversation with Dr. Nick Restrepo. He is Valley Health's Chief Quality and Patient Safety Officer, about Valley Health's recently being named one of the nation's top 15 health systems. But before we jump into that, he gives us a little bit of his background.
I came here in 1995, a long time ago, right out of my urology residency. I went to medical school at the University of Virginia, then I did my residency up in Pennsylvania at Penn State University Health System. Moved here in July of 95, and so spent 15 and a half years practicing with the urology clinic at Winchester on Amherst Street. Absolutely loved what I did. Then came over to work for the hospital as the Vice President of Medical Affairs at Winchester Medical Center. Did that for a little over a decade.
Wow.
And then I was fortunate enough when Mark Nance arrived and he created the corporate structure that he wanted. He created a position called the Chief Quality and Patient Safety Officer. And I was lucky enough to be asked to serve in that role, and I've been serving that role for the past 5 years.
And what does that mean exactly? Are you like walking around and doing like spot inspections?
No, just more than anything trying to put the processes and support in place for the people providing the care, the people supporting those people providing the care, and ensuring that we, at every point of contact with patients, that we're trying to always have harm-free care, high-quality care, and a good care environment also for the team caring for the patients.
So the main thing that we're going to talk about today is the fact that Valley Health was just recently named one of the nation's top 15 health systems by Modern Healthcare and Premier Inc. What does that mean exactly? Is that as big of a deal as I think it is?
It's a very big deal. It's arguably the most significant award a health system can achieve in the United States. It's something we never have achieved, and around here, I don't know that anybody else has up until this year. It fundamentally is quite an honor. It's an award that you don't apply for. You actually don't even realize you're in the competition for it. The group looks at a tremendous amount of data about health systems throughout the United States. It's an award that used to belong to IBM, and then IBM sold the award. The IBM Watson, and they sold the awards, gone through a couple different iterations. And right now, Premier is a healthcare company that does a variety of different things. They do a lot of quality data nationally. They used to provide our quality data services. We terminated that agreement about 3 years ago or so we do not pay them for quality or anything like that. Go along with Modern Healthcare, which is obviously a trade journal. Award different categories of achievement, one being the top 100 hospitals, another one being the top 15 health systems. And we were fortunate enough to be named one of the top 15 health systems, and it's an extraordinary achievement for everybody that works for Valley Health, and more importantly, it's for everybody in the community. It is an affirmation of the quality of care that you can get here locally in any of our facilities, and getting people the right care at the right place at the right time, and just one that we're thrilled to have received.
And to be clear, you're not in the top 15 of only 20 hospitals that were considered. There were 300 some odd hospitals in this mix.
Correct. So the way it works, there's 336 health systems, so not just hospitals in the United States, in this pool of entities that were selected for this award. In order to be in that mix, you have to have at least 2 hospitals in your health system. There are a lot of health systems with just 1 hospital, so you have to have 2 acute care hospitals, and you can have many critical access hospitals in addition to that. We are one of the top 15 health systems in the United States when they looked at those, and they do divide it up into 3 groups. They divide it primarily based on the size of revenue you have as a health system and the footprint that you have in terms of geography. The more states you're in, the more likely you are to be in a larger system. So there's large health systems, medium health systems, and small. We are considered small. We believe we're probably right at the top of small in terms of size-wise. And so of the top 5 health systems that are small, we're in that group, and that is part of the top 15 for the country.
So when you talk about how that's not just an award for the administration of the health system, it belongs to everybody here. Who are those caregivers that you're talking about?
Fundamentally, it's everybody that has anything to do with Valley Health, and even outside of Valley Health, because a lot of the continuum of care type work that we do with different community organizations. But it is an award that clearly is driven by the people providing the care at the bedside. And so that can be physicians, nurses, respiratory therapists, physical therapists, occupational therapists, everybody actually the hands-on. But those individuals are supported by literally a couple thousand other people who make sure that they have the resources they need, the environmental services workers, the biomedical engineers. It's an entire team that's required. Healthcare is very much a team sport, and it's the entire continuum of the Valley Health family that won that award. I would argue that it's them and not the administration who win the award. Okay, it's really the people at the bedside, the people in the clinics, the people interfacing with our patients and trying to make sure that we improve their health in any way we can.
I've had conversations in the past with Chris Rucker, and he talks about how we sometimes misinterpret who the frontline workers are. We think of the nurses and we think of the doctors and the ER people and all of that sort of thing, but we forget that there are a lot of people behind the scenes that are still frontline workers, because without them, they wouldn't be able to do their jobs, and this award really does recognize them as well.
Yeah, well, absolutely. Everybody impacts the care the patients get. I can sit down with any member of the Valley Health family and explain to them their direct connection to how patients are impacted by the work that they do.
It's like the 6 degrees of Kevin Bacon. So how does that translate then down to the patient themselves? So if someone is listening, and it's highly likely that as a Valley Today listener, they're also a Valley Health patient or have been at some point in their life, what does that mean for them the next time they walk through the door? Does it have any impact on them?
Ideally should. I mean, they should recognize that the award is an objective award, and it's based on real outcomes and real measures that translate to lives and changes in patients' well-being. So there's 8 different measures they look at. All the measures are measured equally. Some of them are hospital type things, what your 30-day mortality statistics look like, what your complication rates are, what your hospital infection rates are in comparison to the rest of the country. They look at what your mortality after discharge is, what your readmission rates are compared to the rest of the country, what the patient satisfaction scores. They get them directly. We feed no data into this. The state all comes from external sources, whether it's the government, a variety of different government agencies that have our patient satisfaction data and all those other outcomes that I mentioned, and also what the cost of care is. There's a Medicare cost equation in there, what your length of stay is as well. These are numbers and statistics, but all those numbers and statistics are actually individuals' lives and their families. I think that for the person that seeks care in this region, it has to be very affirming that you live in a place where in your own area you have access to top quality care that can take care of virtually everything on the adult side. On the pediatric side, we partner a lot with other organizations because you need more infrastructure and more population for the care of those individuals. But other than transplant and burns, we pretty much do everything on the adult side throughout the Valley Health family. And our intention is to make sure that you get the care that you need in the best location for you, and try keeping you close to home. But if that hospital is a hospital that doesn't have those resources, then they come to Winchester and we can care for you here.
That's the other perk to the geography that you cover, is that no matter where you live, practically in the Shenandoah Valley, whether it's Inwood, West Virginia, or it's Shenandoah County somewhere, you're close to a Valley Health facility in one way, shape, or form.
Absolutely. And we work as a system, and the award actually, one of the things they look at, it's 5 years of data, so it's not just like a blip in the data. They look at a data pool for all those measures that I mentioned. It's 5 years of data, and things that they look at that speak to what you're saying is that across the spectrum of that data, if any of your hospitals is performing poorly in any one of those measures, you're not eligible for the award. So again, that consistency of care, consistency of quality of care. Our hospitals are very different hospitals, but they care for the patients that they're equipped to care for. And then if they're not able to care for them, they move them here. If they're here in Winchester and they need to be moved somewhere else, they'll move to either Inova Fairfax or University of Virginia or places like that. And Inova, for their first time, it was one of the top 15 health systems as well. They're in the large health system category. But again, this region is very blessed to have access to incredible quality of care.
I feel like it's an advantage to Valley Health as a whole to be able to have this type of geography and have access to all the services that people have here.
Oh, absolutely. The other thing is it's a locally managed and locally governed health system, and so the board of trustees, the executive team are part of the community and understand the needs of the community and the resources that are available to us and how we can best optimize those resources to improve the quality of care that we provide.
I think sometimes people who are not in it, like someone who's perfectly healthy and doesn't really have to do a whole lot to maintain their health, they don't think about their health system or what's going on behind the scenes or what's happening necessarily in their backyard. But this is something that they really should pay attention to, whether they're going to be coming in for surgery or they have long-term care issues, any of that sort of thing. This award really does highlight everything across the Valley Health spectrum.
It does, and it also highlights the consistency of care in terms of doing the right things for patients at each individual site. And another component of the way they statistically analyze this information is they look for improvement over time. No health system's perfect. We're not perfect. We don't claim to be perfect. But what we are is we're a learning organization, and we learn when cases don't go the way we like, and we also learn from one institution to another. One of the things they look at is if you have, at the beginning of those 5 years, because they got 5 years of data, at the beginning of those 5 years, if you have a hospital or two that's not performing as well in one of those measures, and you have a hospital or two that are performing really well, if 5 years later you still have the two good performers and the two not so good performers, that penalizes you. And so our data shows that any metric we learned as a system and we improved as a system. And that's something we're very proud of the team.
It also speaks to the fact that things change so quickly and anything could happen. I know you were instrumental when we were living through a pandemic and how all of that was being managed and being taken care of. But things can change so quickly that you really do have to keep your eye on all of the different things. And then you have something like this that comes along and looks at all of that data and says, hey, good job. You did really well with this thing or that thing in the bigger picture.
Healthcare systems, in the United States, there's a principle called high reliability in healthcare. What high reliability is how do you do complex tasks with little loss of life or resources? And Valley Health's been on a multi-year journey of high reliability, and part of that is exactly what you're describing, is that ability to be operational and functional despite adversity. You have to fix the airplane while flying it. And that's our reality. There's a lot of science behind how to do that, a lot of very academic work in that, but the fundamental principle is that we learn and we continue to evolve and we're ready and we're flexible and we understand how the different parts fit together so that we know that one influence can influence another area. And so I think we do a very good job here at Valley Health managing that.
And we're not even talking about a simple process. When you're putting together clinical quality, patient experience, and then the all-important cost, that's a lot to try and balance and make sure that everything is coming out not just equally for the bottom line, but for that patient experience and for those health outcomes.
That's exactly right. So when you look at the value that Valley Health provides to the community, the better the outcomes, the more valuable it is to the community. The lower the cost, the more valuable it is. And so it's a balancing act, but the important thing in the award release from Premier specifically states that these 15 health systems did achieve these outcome results and these financial results, not one versus the other, not sacrificing
separate of each other.
Correct, and doing it at the same time. That's really what the great achievement that we're so proud of is.
So in 2025, you guys have opened 2 new healthcare facilities. You have broken ground on the behavioral health pavilion. I'm very excited for when that opens. I always have to work robots into every conversation I have with any Valley Health person because I am fascinated with these robots. So you've got all of these great things that you've been doing in the last couple of years. Where does this award rank in all of that for you?
This award for me is the best healthcare award there is, okay? Those other things that you're mentioning are a representation of the fact that we constantly are reinvesting and improving and making this place and all of our facilities better for the community. I toured the Behavioral Health Pavilion this morning. It's a beautiful location. It's going to be fantastic opening later this year. We toured the new rehab hospital we're building earlier in the week. Again, tremendous asset for the community. And so the benefit and the beauty of Valley Health being a not-for-profit organization is that when you do have a profitable margin, it's reinvested back into the community. It doesn't go off to some shareholder somewhere. Again, these investments in people and processes and technology are what make this such a great place.
I would imagine that getting this award too is going to serve as such an inspiration to all of your staff across the entire health system to maybe be more proud of the job that they have and want to go even a little bit more extra and over the line to continue.
Yeah, they should be exceptionally proud. If you look at our outcomes over the past 5 years, what has been the lead indicator of great outcomes has been our employee engagement survey. So we do a survey with an external agency. It's all anonymous. We don't know who said what. And that score has been on a trajectory upwards over the past 5 years. Truly remarkable. One of the surveys that we use, which is a big culture safety survey, we were one of only 2 health systems that improved during the pandemic in the United States. And so we've gone from the 20-ish percentile to just below the 80th percentile of employee engagement. Why that's important to me, that's a very important quality measure to me, because you can't achieve these results unless you have a really engaged and aligned group of people taking care of the patients.
Yeah, if you have people that hate their jobs every day, they're not going to do the quality of care that you need them to do.
Exactly, and they're not going to be a part of creating solutions. And so our team, our bedside team, they identify the issues, they create lasting solutions, and they're fully engaged in the mission of Valley Health and the work that we're doing for the community.
I want to make sure, too, that we recognize Mark Nance's role in all of this as the CEO for Valley Health, because he has made a lot of improvements. He has really, I think, brought Valley Health as a whole into this new generation of what healthcare looks like and what standards they should be. So I'm wondering, did you catch him doing cartwheels or anything in his office when this news came through?
Yeah, we did them together. He was much better off than me doing them, but I can't overstate the role that he's had. As I mentioned earlier, I've been here 30 years, and the single best thing that's happened to Valley Health was that the Board of Trustees hired him. He's a guy who understands the people that are doing the work and what they need and has supported them from day one. He's the person that drove Valley Health during the pandemic to not lay anybody off, to keep everybody economically whole. He realized, and he said, then we're going to come out of this thing. We need everybody on board to come out of this thing. So he took care of the organization throughout the pandemic, and he has emphasized our prior strategic plan. The strategic plan we're actually just wrapping up now. The first pillar in our current strategic plan is care for the caregivers. And when that was adopted, it was a very intentional decision by Mark and the executive team and the Board of Trustees. And there was excellent discussion around the importance of having a healthy care team in order to get great outcomes. Part of that is providing an environment that's psychologically safe for them to raise issues, and we've done a lot of different things to be able to make that an easier process, a more worthwhile process. Another part is a physically safe environment for those patients. One of the things that I wish that people would recognize, and it's been problematic particularly since the pandemic, healthcare workers, it's become a high-risk job physically in that there's violence against healthcare workers is a sad reality in this country. We're doing a lot of things to try mitigating that and to try de-escalating situations, and our security force is really top-notch at this time. But the public has a role in that as well. And so one of the things I would love for the community to do is realize that people that go into healthcare do it for good intention.
Right.
They come to help you, and there's not any real benefit to coming in antagonistic and looking for a fight. If we treat each other with a little bit of compassion, give each other a little bit of grace, that environment of care will continue to improve even more.
It still boggles my mind that that is an issue at all. Chris and I had a conversation about that last year. And when he said it to me, I'm like, no, that doesn't really happen, does it? I think more people need to realize that it happens way more often than most of us know.
Oh, it absolutely does. And there's legislative efforts both at the state and at the federal level to add some teeth to some penalties around this. There's the well-known shooting in York, Pennsylvania. There's up in Hagerstown, there was an issue. It's not infrequent that this happens. And it really is, these are people that are the best of the best. They've sacrificed their lives, they've missed kids' Christmas, they've missed kids' birthday parties, etc., caring for others. And for them to have to be worried about their physical safety because people escalate too quickly and become violent with them is really a tragedy. This award was not achievable 5 years ago. It's directly a result of the strategy of taking care of those folks at the bedside, making sure that they have what they need, supporting them in the care of their patients, providing a safe environment for them to work in, both psychologically safe and physically safe. And this is a culmination of that and a recognition that, hey, we're headed in the right direction, and this community is exceptionally blessed to have Valley Health.
Are you going to have it a second year in a row? Do they do a second year in a row?
They do. Mayo Clinic's leading the pack on that, and Methodist Health System down in Texas. We'll be in the mix. If not next year, the year after, we'll be back there, but we'll be in the mix. Things are heading in a good direction, continue to head in a good direction. And again, this came as a total surprise. We got an email saying, hey, you got this. And then we've met with the company and kind of reviewed the data and talked to them. Hopefully we'll get the same similar surprise early next summer.
Did you initially think, wait, is this a spam email?
I did.
I had a conversation with someone over in Front Royal when they got the email that the royal family was coming to visit, and they thought it was a scam, and they deleted it at first until the second email came.
Absolutely. We did a little pulse check on that one, and again, once we realized it was real, we were thrilled.
I think this speaks to all of the things that Valley Health has done, and you mentioned all of Mark's accomplishments and the goal of the Board of Trustees and all of those things, but there are likely still people out there that have no idea what actually has to happen behind the scenes when they have to come to the hospital for any number of things. My last question for you, I guess, is there something that you wish they knew that you don't think they do?
It's hard to just generalize what the community knows and doesn't know. What I would like is for everybody in the community to recognize that what we're doing here is very special. And we are a smallish community with a tremendous health system built over years of dedicated work by thousands of people, heading in a very positive direction. And our goal is to remain a locally managed, a locally governed health system, because that way we can connect to the community that we're working to improve.
And you have to do all of that in spite of all of the outside factors that come into play. Medicaid cuts, Chris and I have talked about that in the past, all of the other things. You still got to roll with the punches and keep that level of care at the quality level that you want it to be.
It's absolutely right. And part of it's also redesigning how we provide care, because it's very easy for us to default saying, oh, they're not paying us enough. But we can also say, where could we provide care more efficiently in a setting that's less costly to the patient and to the payer? And so it's constantly innovating and making sure that we stay ahead of that.
Dr. Restrepo, thank you for taking the time to give me an education on this award. Congratulations.
Thank you very much.
Well, that's it for me today. But before I go, please, if you happen to find yourself at a Valley Health facility, be sure to say thank you to that healthcare worker, that maintenance worker, that administrative person. Give them a pat on the back. Let them know that you appreciate the work that they're doing. Even just a smile goes a very long way. I will be back tomorrow with a brand new episode of The Valley Today, just a few minutes after noon. So meet me here then.